ECG or electrocardiogram is a graphical representation of the electrical activity of the heart. It's a very important diagnostic tool for various cardiac emergencies which can be mastered by analyzing as many ECGs possible. I have simplified ECG reading in 5 simple steps which can be remembered by the mnemonic called crawl, where C stands for calibration, R stands for rate, R stands for rhythm, A stands for axis, and WL stands for waveforms and the respective lengths. Calibration or standardization is a set of parameters printed on almost every ECG and goes by voltage of 10 mm per millivolt, that is 10 small boxes, speed of the paper, that is 25 mm per second, L1 or lead 1 is usually upward with a positive deflection and AVR is downward with a negative deflection, but its opposite can be present in condition of dextrocardia. Rate or heart rate for regular rhythm can be calculated by formula, that is 300 divided by number of big boxes between 2 consecutive RR intervals, whereas for irregular rhythm like atrial fibrillation, heart rate can be calculated by formula, that is number of R waves in 30 big boxes, which corresponds to 6 seconds time interval multiplied by 10. Rhythm of the ECG is called sinus if P waves are present before every QRS complex. Normal ECG axis is minus 30 degree to plus 100 degree. Axis deviation between minus 30 degree to minus 90 degree is called as left axis deviation, whereas axis deviation between plus 100 degree to plus 180 degree is called as right axis deviation. It can be simply remembered by this method called if S wave is more than R wave in lead 1, its right axis deviation, whereas if S wave is more than R wave in lead 2, its left axis deviation. Waveforms and the normal lengths in duration are as follows. P wave represents atrial contraction and has a duration of less than 3 small square, that is less than 120 milliseconds, and height of less than 2.5 small square, that is less than 100 milliseconds. PR interval represents time interval between atrial and ventricular contraction and has a duration of 3 to 5 small square, that is 120 to 200 milliseconds. QRS complex represents ventricular contraction and has a duration of less than 3 small square, that is less than 120 milliseconds. ST segment represents time interval between ventricular contraction and relaxation and has a duration of up to 80 milliseconds, that is 2 small squares. Elevation or depression of more than 2 small boxes is considered significant and can represent ST elevation MI or non-ST elevation MI. T waves represents ventricular relaxation and has a duration of up to 160 milliseconds, that is 4 small boxes, and height of less than 5 mm in limb leads and less than 10 mm in chest leads. QT interval represents entire ventricular phase, that is contraction to relaxation, and has a duration of up to 450 milliseconds in males and 460 milliseconds in females, that is approximately 11 small boxes.